you can refer to on Blackboard. It says positioning and early mobility. You do not have to practice positioning, and this will not be a component of your practical exam. Might be a question on your written exam, but positioning is something you did in clinical skills, and I don't need you to repeat it. I'm just going to review it for the purpose of if it was a patient that had a stroke. So in our patient scenario, say if the patient had weakness on their right side, a lot of times what happens with our patients is they might have a retracted hip, they might have a retracted scapula, they might develop some edema in their hand because of their no muscle activity. They might be asymmetrical in their head or their trunk. And so I'll give you some guidelines of what we might incorporate into their positioning. So this is a really easy way to just give a little bit of a cervical roll into the pillow to help keep their head in midline. So I'm going to swap after pillows, patient. He's such a good patient. And you can position it. So, and what do you think about that? Yes, okay? All right. So that's one quick thing you can do. If the patient has a retracted scapula on the side, what we want to do is roll them just a little bit, and we'll place just something small underneath her scapula to prevent any kind of retraction. And we certainly can use some handling skills, and if she is retracted, place her in protraction. We can also do the same with the pelvis. If her hip is retracted here, we can take a little pillow, a small pillow or a pillowcase or a sheet or a towel roll, and we can prevent the retraction. So using something not very thick, but just enough to correct the retracted position. For the upper extremity, what happens with the hand and the wrist, they tend to have some risk of edema in the hand because they don't have active motion of the distal part. Also, positioning of the shoulder, we would retract if it's retracted, we would protract the scapula. We would bring the arm in a little bit of abduction. We would let the elbow flex a little bit. We want the crease of the elbow to face up to give a little bit of external rotation to the shoulder. But the forearm will be pronated, the wrist will be slightly in extension, and the hand will be open. So position with whatever you have, that's your goal, and that will kind of go into what correlates with positioning in your handout. For the lower extremity, there's a couple of things you can do. You can have their legs straight. Sometimes you might take a small towel roll and put it underneath the knee if they have a lot of extension tone. So you can break up that tone by just putting a little flexion into the knee. You would also maybe put a towel roll underneath the heel. What would that prevent? Right, any pressure, right? Oh. You can also place the legs into flexion, and if they don't have enough control to keep it in flexion because they have decreased motor control, sometimes if you place the pillow more upright and it's a stiff pillow, it helps to hold the feet there. So you can, sometimes they might be in a weight bearing, and sometimes they might be supine with their legs extended, but again, that towel roll underneath the knee to prevent extension, positioning of the leg, and underneath the lower ankle to minimize pressure on the heel. I think that's everything in supine.